very inspiring to read about HempStreet and how you've taken up indigenous Ayurvedic knowledge from the Indian subcontinent and spreading it to the world. Despite all of these challenges and the lack of a regulatory framework, what led you to begin HempStreet?
The short story is essentially there was a massive amount of problems in pain relief in particular. So, I mean, to be honest, we started off looking to, the opioid crisis in the US, being kind of a co-founder for an incubator and generally being in the startup scene, being aware of healthcare, understood that if that happened in India, it would be insane. Millions of people dying, dropping like flies if you had no. I mean, we do have an opioid crisis in Punjab, but if it spread to the rest of India, it would be crazy. I mean, and we thought cannabis could provide some of that, some respite. So as we progressed, we realized there were many more mass ailments. Pain was as a business person or it was a smart choice, but as a somebody trying to solve mass ailments, pain is I would say, a lazy choice, right? I mean, there were a lot more very specific ailments like menstrual cramps that we pioneered globally. The industry was a much bigger problem, I would say, and more specific problem to solve. So that's why how we started and why we're here.
Thanks for sharing that. And I think you speak of menstrual pain and pain management. So, I mean, if you could, on that same line, tell us a little bit more about other cannabis-based medications that HempStreet is able to tap into and solve these ailments for the larger population in India and worldwide.
So we've looked at gut issues. I mean, we started talking about cannabis for gut health 4 years ago. We realized that they were, and then the whole antacids call out happened. I don't know. I think we preempted sometimes. We've been talking about menstrual cramps since 2019. Then the fiasco with the pharmaceutical product came up. We were talking about gut health around the same time. Then we had this whole call out of antacids, which you were popping like chocolate when we were kids for stomach. So I think that's a big avenue. Then there's some work we've been doing around palliative care without much fanfare in the southern states. And that's something we're committed to providing some part of the palliative care journey or cancer pain or cancer related symptoms, some part of it. Not, it would be foolish to say cannabis can solve some of the much more major issues because that's really not research proven yet. I mean, again, I think it ends up being the responsible thing to do, right? Essentially, one of the fallacies of having a massive recreational market driven by the US is that you assume that everybody is fine with cannabis, right? You assume that everybody is a regular user of it, which is also a metric in the US. I think last month, for the first time, more people use cannabis daily than liquor. That's never happened, right? So and I think that's a big milestone, but it means nothing to me. But it just means that it's more familiar. In India, as we did our clinical trial, we understood how massive the stigma was on a B2C level. On a B2B, yes, the doctors to a certain extent took us 2 years, but we educated them. But there's a massive stigma on a B2C level. And I think that required you to be more medical. I think the reason why we've been in clinical validation is that you owe the patient a responsibly dosed product. Even with cancer, even with most ailments, you have to understand the role that cannabis plays. One of the big elements is quality of life. In palliative care, people should be comfortable. It's appetite, it's nausea. I mean, as a person that's not in palliative care, as a regular person like you and I, you don't want to feel vomitish. You want to be able to, have your appetite. It kind of sucks if you can't eat. And you want to deal with pain. So I think what the idea with cannabis, what you wanted to do really is to improve some of those quality of life indicators. And second is to basically aid the reduction of some of the medication that they receive. And I won't tell you what it is, but the idea is, can it solve in a way that the patient is not an invalid, right? And I think that's really the role cannabis can play in palliative care.
And I think this the kind of passion you speak about for the plant and your vision with HempStreet and how you are leading on as a trailblazer in the Indian cannabis space. It's quite inspiring. But how do you navigate a regulatory landscape in a country like India, where you know that there is the stigma is high, the laws aren't clear, there is traditional medicine versus there is the approved drugs. How do you navigate that if you were to give advice to entrepreneurs or folks entering the cannabis space to solve real world problems and be passionate about patient care?
I think key is to keep your eye on the solution, right? So menstrual cramps are not going to change. Cancer is not going to change. You may prevent it, but it'll occur. Cancer is not going to change. The ailments are not going to change. I mean, essentially, just like vaccines, where you have tremendous focus on an ailment, you chase it down till it gets eradicated. Maybe it will never be eradicated, but to be able to provide the best solution constantly as delivery mechanisms evolve, as frameworks. See, end of the day, if your product solves an ailment, and you have gone through the clinical rigor, then all regulations are manageable, right? The idea is, I think everybody was tempted by how Thailand opened up, or which had its own issues, right? They're rolling back some of the stuff. How the US, a largely recreational market, went nuts. So they're saying, oh, India is, but we're federally legal for medical. So if you put in the work, you can get on every shelf. You can get to every patient. Today, we're in, like for example, Trilokia Vijayavati, which is a classical formulation that we started with, essentially, right? We've now moving on to much more, research-backed stuff. But even that we did a study, and we were in 26 states. So if you want to scale, you can scale. You can compare it to other markets, saying, "Oh yeah, wow, we have so much VC money, and we had so much VC money in Canada and the US. India is yet to receive a single dollar from VCs, or that in the US, but the US is regulated state-wise. It's not in India. We are federally legal. It's just up to us to create world-class products. And the second thing I really wanted to touch upon about cannabis is that as a company, HempStreet as a company, right, we always focus on the lowest dose you can give a person to achieve the full medical effect without having any psychoactive effect, which is also not a common thing given leaf. But so we don't sell super high concentrates. We don't sell, we try to have, because in the global south, women, especially with menstrual cramps, so women don't have the luxury of taking the day off, right? Most women have to go out in the fields or take care of the family or cook. They don't have the luxury of day off, so they don't have time. The risk of getting somebody feel the psychotropic effect, I would much rather them take 2 or 3 pills of a lower dose product and titrate upwards than have issues with the first time. Because unlike the rest of the world or wherever, in fact, the same rest of the world, most users, believe it or not, will be first time users, first time patients of cannabis. And with the stigma that they're coming with, you want them to feel nothing but relief. You don't want them to feel anything else. And I think that's the challenge. And that's what India can teach the world. And that's what we've been successful at. As THC levels have gone insane in California or wherever else, where I don't know, you probably get brain damage from smoking that regularly, I would imagine, or ingesting it. And we are able to produce medicinal benefits in extremely low concentration. I think that becomes the skill. You're able to provide something that potentially people can use every day. And that's why when we are going across the ocean with our intellectual property and the patents that we filed, we find ourselves in an advantage because America has grown from a recreational market, which means stronger, better. Unfortunately, that's not the reality, but stronger, better was the deal, right? More THC. We've been able to build the ground up while actually feeling for medicine.
Absolutely. And I think, as you mentioned, that despite the challenges, I think it's impressive how you were able to take on the plant without presenting its psychoactive elements and giving the right efficacy to the patients to solve these ailments. I see that you have over 5 approved medicines in this space. And what are the most common challenges with the distribution, like you see in a country like India, where every state kind of operates like a different country, and even when expats come to do business here, it's not the easiest one to crack. You're still way behind in the ease of business. How does one go about this?
I think there's a lot of process. I mean, the regulation happens on a raw material level, on a product approval level, and then on a sales point level. But I think our greatest uh, whatever effort went into convincing people that this was safe. And so as a result, you can't define yourself around what you've been regulated by, right? So, for example, we went out of our way to set up a dispensation, tracking system using blockchain. We were the biggest installation of blockchain in cannabis at the time, right? We don't provide any sales, right? We have a lot of consumer traffic, but we send them either to doctors or now to our partner sites because it's a responsible thing to do. So I think while being regulated, we've self-regulated more than the government is regulated. In fact, today I'm federally legal. I can distribute, I mean, I can sell it in any state, provided it's via prescription to the doctor. There is a lot of regulation, which is characteristic of doing business in India in most sectors. But it's a large problem we're trying to solve, and we'll do what it takes to solve it. I think we're not driven by a 3-year plan or something like that. When we aren't VC backed, we're backed by believers. We've raised a significant amount of money, so there's a lot of believers. Really, we've always done the right thing, I would say. And yeah, that so regulations are many, but it just takes time. Like this paperwork, and if you want to get to achieve the goal that you're going, which is to get people better, I think you'll do what it takes, right?
That's very impressive how you make it sound so easy doing this
Yeah,
all in.
definitely wasn't. I think our approach of low dose will be really where it's at. I think the idea is it took us 4 years to get here, but we always stuck to that, the ability to create maximum medicine value and not essentially a masking technology, like, yeah, sure, somebody's got a high dose and you forget about everything else. So I think the idea is how can you let people continue working every day without, live their normal lives while taking it like a supplement that works medically. I think going beyond what the government regulates you to do, I think developing something that you're giving to someone that needs it, right? I mean, providing that person the medical benefit and ensuring that they're receiving the best care. And I think that requires a certain level of responsibility. And I think if you take the long view, you do always do a better job.
A question though, I mean, leading a company and getting into different forays at the same time as a CEO, developing new drugs, taking care of operations, distribution, sales. How does one manage the pursuit of medical innovation, financial sustainability, and growth of the company? So, as a CEO, I think that's a question that's always on my mind, and I would like to hear your side of the story.
It's not easy at all. I think there's unique challenges, especially doing business in India. The time frames of everything, the fundraising at the same time, which we've done fairly successfully. I've taken over the last couple of years a very, very active role on the ground. I think that's helped me understand that we were wasting our time on some things. It gives you a tremendous amount of focus because you feel everything real time. Right? There's a lot of layers in your organization which there aren't anymore. And in HempStreet, I think we've refocused over the last 2 years. It gives you an immediate feel of what's going on the ground. You can react immediately. I think I was not better off for having delegated a lot before, and I think now, and the industry is still in its infancy, right? So it's great to be a leading player still, while I've reconfigured the business, focus a lot more intellectual property. We've always been on the clinical validation part. So I think it's a super tough job, especially with kids and a family and the travel. And our industry doesn't have wasteful money, right? We don't have an insane, we're not a fintech or quick commerce, right, where they throw money at you and you can kind of like make a lot of expensive mistakes. It never was a luxury for us. So yeah, the short stories, yeah, it's really tough. And the long story is that these little things that you get to do every day that have a outsized influence on the company in real time. I think that's been the fun part. This has been the hard part, but that's been the fun part.
I hear a lot of passion. So I think in the hard days, it's not the idea that counts. I think it's the execution and the love for your idea and the passion that.
Perseverance, perseverance. I think if you stick around for 10 years in any industry, you'll make it. I mean, as long as you're doing not, you're not sticking around burning a ton of cash with no aim. I think when we really saw a massive, there was a lot of private individuals investing in cannabis was when the US stock market is booming, right? Canopy and everybody. And that's kind of slowly making its comeback because a lot of young people in the US is a recreational phenomenon. But that's a part where we can actually really, really win, I think, as a country, as an industry from India, is the low dose.
Thanks for that piece of knowledge. What would be your one piece of advice to entrepreneurs that are entering the cannabis space or who really think that there is a gold mine and all of us are mining some gold that may be green in color? So, what would be your 2 cents to them?
Product innovation, man. I think that has been the cornerstone of everything that we've been doing. And the idea is if everybody's going to sell hemp, what do you call it, hearts, and if you're not doing nothing for the consumer and you're not competing with other players, you're competing with superfoods, and they have well-heeled distribution networks and kind of clinically proven a little bit, whatever. So I think the idea that just because it's hemp, people are going to buy it in a medical or nutritional scenario is not the truth. Like they will buy the best product in class, right? So when we make a product, we have to be better than the incumbent across the board for that solution. So I think don't get into hemp creating the hemp version of that. That is 100% failure because you don't have distribution nor do you have innovation. So I think product innovation. So we've faced a lot of people launching the exact same classical products and all that, and it's been weird. But I think that will be the future. If you want to solve a problem, you have to have a better product than what's out there across the board. I think that's it.
I hear the first one being passion, innovation, and I think that relentless execution should be there. I think nowadays entrepreneurship to me is sounding like sports, where one really needs to be beating their opponent and get ahead of the game in what they do, be super passionate about it. And moving on, you mentioned hemp hearts and the larger industry. I know that you've been working on superfoods as well. Cannabis seeds were once a superfood staple. I mean, what's your take on that, and what are you doing about it?
I think we also followed the adaptogen theory. They're basically our products are polyherbal. Cannabis does anti-inflammatory, less pressure on the organs because it's absorbed in the stomach largely, and anti-anxiety that helps your immune system fight better. But for specific ailments, you add stuff like bamboo silicate for inflammation, for example, right? Uh, so I think the same thing as we looked at ailments. So there was a massive. I mean, I noticed this every time I was in India. I noticed this other places were that young people were consuming a lot of energy drinks, were consuming, there's a lot of Adderall that's illegally in India. I think amphetamine. So I think you forget what's illegal and legal, but you look at what the problem that they're trying to solve, which is staying awake and alert, or in general, just a mental clarity. So I think we worked with our partners to see something with coffee and cordyceps, and I mean, the initial users have already ordered thrice. So it's something I think is a genuine innovation that's safe. And the second product is a clinically backed blood circulation improver. Blood circulation is the cause of a host of problems, and our initial testing, it's working with really well. Our initial users with gym users and stuff like that. So I mean, we're not making any medical claims. And then we have UTIs affect about 15% of Indians, men and women, largely women. So we developed something that was tasty, but also with cranberry, so it would help with UTI. So I think that's really the three big ones. We've got a sexual wellness, which is not Viagra, it's long-term sexual wellness. The idea is we wanted to bring something that was nutritious, but also very functional, because the energy bar segment is completely crowded globally. You don't know your best from your worst, right? And it becomes less of a product. We've always been about product innovation. So I think we think that's really what's going to set us apart here as well.
Congratulations on that. And I think it's great foresight, and also that you're doing everything that is clinically backed. And I think post-COVID, I've seen this phenomena, not just India, but worldwide, where the wellness industry is kind of moving from wellness to being well-being and preventive medical
Yeah,
care.
yeah.
So there's a lot on that end people are paying attention to, and they want to work on their vitality, work on their general nutrition, work on taking in natural products. And I think hemp and cannabis both have a long way there. What's your take on the preventive medical care and well-being industry in India or Asia?
Indians are getting more aware. The idea is, there's a gap. The What happens when you go from lower middle class to middle? I mean, I hate to use social classes, but it's kind of the economics in my head from college. So you go from low middle class to middle class. You've suddenly discovered, I would name the names of fast food, right? Because you're suddenly able to have a discretionary meal. Now, as you work, it tends to become more. Now, when you go from that to upper middle class, you're like, oh yeah, I'm going to buy this organic stuff. I need to be in the gym. I need to go to Pilates or whatever. But that gap of a societal movement is about 10 years, right? So you're now Mr. Fast Food, and you've got 10 years before you realize it's really bad for you. So we're seeing, and I think that's the danger, that India is now the diabetes capital of the world. I think obesity is not too good either. I think that's the phenomenon. People have left semi-poverty and become kind of middle class, discretionary. These are all things you could never afford before, so you consume. And then I think as you get wealthier, you become more aware of your longevity. And I think we're seeing that in India. We're seeing both. We're seeing a tremendous uptick in unhealthy metrics like diabetes and stuff like that, because people have started their journey of being better off but unhealthy, and then they shift into healthy, but that's it's such a big population. It costs a massive, I think, a medical bill. So I think a lot of the upper middle class folks, a lot of our startup folks like us, they're getting more, well, thinking about their longevity, and I think that's triggering a lot of good and bad. That some people are like now uh, going overboard with the whole exercising thing, becoming recluses on their virtual spin class or whatever. I think people are aware, and I think the industries will be massive. And I think at some point, insurance companies should probably get in on it because the healthier you keep your base, they're not going to make claims, right? So I think that's something that would be very interesting to see if insurance companies start investing in some of these apps and services. I think we have to get our rural folks healthier. We have to get second tier India to get something that's not fast food, something that tastes good but is healthy. Like I think, like Soulful, it's a millet. It was acquired by Tata, it was founded by a friend of mine, and I think it was a visionary thing to make it cool to eat millets, right? I think that is. I mean, yeah, sure, it was a great business, and Tata bought it, and he's a super smart guy. But I think the visionary part was he made it cool to eat millet, stuff that we've forgotten about, ragi, and I think he made it cool. And that's you can't change the influence we've had from global media and all that, and watching everything that we have. But I think if you make what we have cool, that can be given in a cost-effective way to most of India, I think that's the future.
That's quite on point. And with this tip of the iceberg and ever growing, and the mission that you have taken up, despite its challenges being, you've got making India healthier, natural, and focusing on well-being, which is clinically backed, and doing that all at the same time, and coming into an industry which is not very well funded at the moment. So kudos to you on doing that and leading this way.
Thanks, man.
So I thank you for joining, and this has been a great session.